Hi, I'm Dr. Eric Baser. We have an expert on the set, Dr. Richard Frank, who's Director of Cancer Research for Nuvance Health and here at Norwalk Hospital. Dr. Frank, Richard,
Yes.
the question from our viewer is, would you highlight one of the latest positive developments in cancer research? I know that's hard because it's really been a potpourri of positive developments, but what do you think are one or maybe even two of the most exciting developments?
I'll pick out liver cancer or hepatocellular cancer, which traditionally, when a person gets liver cancer, they may or may not have underlying liver disease, cirrhosis from hepatitis or alcohol or unknown reasons. That's one risk factor, but liver cancer can be very difficult to treat. It does not respond to chemotherapy. We don't give chemotherapy. It's usually treated either with surgery if possible or ablations, where you deprive the blood supply or you...
Yeah, either radiate it or you
That's
literally
right.
mash it up.
These are just local treatments, and then people survive for as long as they can, which is often, less than a year or two. But now new treatments with immune therapies and angiogenic therapies, so Avastin plus a drug Tecentriq is newly approved. So it's an immune therapy and a targeted therapy, and now they're having dramatically better results with liver cancer in this situation.
That's really amazing. So these are two therapies, neither one of which existed 10 years ago.
Oh, yeah.
These are targeted, you mean targeted against the genetic defect of that particular cancer?
This one's against the blood vessel growth of the cancer, so bevacizumab or Avastin, yeah. So it's just the more trials you do, the more combinations you use, you can come upon with a really, with a winner.
And it's funny, because sometimes you wouldn't predict
Yeah.
which cancer would be the most responsive.
You can't. There's no great models. In a test tube or in a dish, as you know, you can make anything happen, even in a mouse. People come to me a lot and they say, "Look at these results," and I say, "It's great if you're a mouse."
And I have to cut you off.
Okay.
Because we have run out of time. I want to thank our guest today, Dr. Richard Frank, for joining me on Health Talk, and thank you for watching. Remember to send us your questions and comments to healthtalk@nuvancehealth.org. We'd love to hear from you. See you next, and be optimistic about cancer. Things are happening.